Hello friends, I am Dr. B. Archana, a homeopathy doctor from Chennai, Tamil Nadu, India. I completed my BHMS degree from Venkateshwara Homeopathic Medical College, Porur, Chennai, Tamil Nadu in 2007. I am practicing homeopathy since 2014 at my clinic, Dynamic Homeocure. I am applying GHK or GNM knowledge in my clinical practice since 2017. I did my SCPH under the guidance of late Dr. Praful Vijaykar sir in Predictive Homeopathy Academy at Mumbai in 2017. I completed my SCPH Plus under the guidance of Dr. Ambrish Vijaykar sir at Bangalore this year. I am a member of Dr. C.J. Varghese sir's Global GHK Foundation ever since it was started in 2017. It is my privilege to be a part of Global GHK Foundation and a mentor being a mentor, teaching, learning GHK and growing knowledge wise along with the team. Today we are celebrating the 8th anniversary of Global GHK Foundation and it is a great achievement indeed. The team has worked hard to preserve the knowledge given by Dr. Hammer under the banner of Global GHK Foundation amidst of hurdles and struggles. Our website www.globalgnm.com as well as our official YouTube channel Global GNM are rich with video lectures on GHK. Our website has the audios of GHK teachings in English, Malayalam, Hindi and Punjabi. We conduct weekly webinars to dispense the precious knowledge given by Dr. Hammer for the upcoming generations. I have also contributed on few topics on basic laws of GNM or GHK, how to elicit a conflict, disease, known and unknown facts, etc. Specific topics like female disorders, bone and joint and muscle disorders and their conflicts, etc. My own YouTube channel, Dynamic Homeocure, is exclusively providing GNM knowledge to the Tamil speaking people. So today, to mark the 8th anniversary celebration, I have chosen a vital topic, liver and GHK. Let me share my screen. We usually address our loved ones as heart to represent that they are very important in our life. But in the state of Kerala in India, where literacy rate is at the highest, people call the kids as Karel, which means liver, because they know that liver is even more important than the heart. So today we will see why is it more important than heart, what are its functions, what will produce signs and symptoms on the liver. Before going into the topic, here is a disclaimer. The information given in this presentation is for educational purpose only. It is not intended to be a substitute for professional medical service. Participants shall consult their medical doctors for health reasons before using anything that is disclosed during the course of this presentation. Students shall not use any of the different information given in this presentation while writing their examinations. Tributes to Dr. Samuel Hahnemann, the founder of homeopathy, and Dr. Hammer, the founder of GNM or GHK, two legendaries in the medical field. Gratitudes to our Guru, Dr. Praful Vijaykar sir, who introduced GNM or GHK to the Indian homeopaths, and my mentor, Dr. C.J. Varghese sir, who has provided me constant motivation and support to be in the learning and teaching of GNM or GHK. So where is the liver located? Liver is the largest gland in the body, weighing about 1.5 kg in man. It is both secretory and excretory organ. It is located in the upper and right side of the abdominal cavity. If you see here, liver is located in this area. In this picture, you can see it. Liver is here in the right upper abdominal cavity. So if you see on the outer surface of the body, it will be here. So lobes of liver. Liver consists of many lobes. Each lobe consists of large number of lobules. The liver is divided into a smaller left and a larger right lobe. So you can see this is the right side and this is the left side. So this is the left lobe, smaller one, and this is the right lobe, bigger one. So the right lobe is further divided into a quadrate lobe and a caudate lobe. Quadrate lobe here and caudate lobe by the presence of the gallbladder and the inferior vena cava. So each lobe has large number of lobules and it is called hepatic lobule. So the hepatic lobule is the structural and functional unit of the liver. There are about 50,000 to 1 lakh lobules in the liver. So each hepatic lobule is a honeycomb-like structure and it is made up of liver cells called hepatocytes. The cells are arranged in different plates. Each plate is 1 cell thick with a central vein. So in between the cells are the bile canaliculi. You can see this bile canaliculi surrounded by the portal triad. Bile canaliculi surrounded by the portal triad. So the portal triad is consist of branch of hepatic artery, branch of portal vein, and a tribute of bile duct. In between the plates, the sinusoids or blood spaces are present. So this is the sinusoids receive blood from a branch of portal vein and a branch of hepatic artery. So branch of portal vein and branch of hepatic artery provides blood to the sinusoid space. So few macrophages called Kupffer cells are also found in between the endothelial cells. So these are the endothelial cells surrounding the portal vein and the hepatic artery. And within the endothelial cells, this red color structures are there, no? Those are called as Kupffer cells. They are the macrophage cells. So if you see the cross section of the liver lobule showing the structures discussed so far, you will see like this. Kupffer cells will be present like this and the endothelial cells will be like this. These are the sinusoids. So hepatocytes produce bile and this bile goes into the bile canaliculi and from bile canaliculi it goes to the bile duct. Now let's see the function of liver. You will be surprised to know how much functions are carried out by our liver. And that's the reason why it is more important than your heart. So liver is the storage house of glycogen. Glycogen is a stored form of glucose. Glucose is the energy producer of your body. So amino acids. So it stores your glycogen, amino acids, iron, folic acid, vitamin A, vitamin B12 and vitamin D. So glycogen is the stored form of glucose and amino acids are the building blocks of your proteins. They combine to form proteins which are the building blocks of the life. So your liver stores iron also. So RBC's production and for hemoglobin production and for muscle functioning and for oxygen transportation, all these require iron. So this vital iron component is stored in your liver. So folic acid, which is very important. So, and it is a vitamin B which helps the body to make new healthy cells. So folic acid is usually given to pregnant ladies, no? So even for ladies who are planning to get pregnant, also given this folic acid. Folic acid helps in making your body to make new healthy cells. So this important folic acid is also stored in your liver. Apart from that, vitamin A, B12 and D are also stored in your liver. Synthetic function. So liver synthesizes plasma proteins found in the plasma of your blood are called plasma proteins. Blood group substances, no. So A positive, B positive and all they say no. So that RH factor. So that RH factor is also produced in the synthesis from the liver. So clotting factors. So the clot, which is a resultant of the circulating plasma protein, is also produced from the liver. So liver produces the clotting factors, which form the clot when you get a cut, injury or anything and the bleeding is happening means the clot only comes and forms a network and that only prevents the blood from getting lost through the cut. So this is produced from your liver. So somatamidin, cell growth and cell division on stimulation by growth hormone. So this hormone is produced from liver and this helps in cell growth and cell division when it is stimulated by the growth hormone. So heparin, once again an anticoagulant, is also anticoagulant means so blood clotting should not happen inside the body, no? So that uh, uh, clotting should not happen inside the body. So anticoagulant should be produced so that the blood is not getting clotted and it gets circulated inside your circulation. So this is possible through this heparin, which is produced from your liver. So apart from that, liver metabolizes carbohydrates, proteins, lipids, vitamins, hormones. Liver also excretes cholesterol, bile pigments, heavy metals like lead, arsenic, and bismuth. Toxins, bacteria like typhoid bacteria and virus like that of yellow fever are also excreted by the liver. So we don't acknowledge the concept of virus in GHK. So this is from the general medical books. So we saw already that liver is the largest gland and it has a secretory and excretory function. So secretory functions, we saw what are all the things synthesized and produced from liver and what are all getting excreted from liver now. So it has also a vital function in the defense mechanism of the body. So Kupffer cells we saw, no? So in this diagram we saw, no? This Kupffer cells, macrophage cells. So these cells swallow the foreign bodies like bacteria through a process called phagocytosis and it helps in the detoxification of foreign bodies and thus play an important role in the defense mechanism of your body. Apart from the clearing of foreign bodies and detoxification, it also produces antibodies. So we saw about detoxification, right? So the removal of toxic property of the harmful agents is also known as detoxification. This happens in two ways. One is metabolic degradation, that is by total destruction of the subject. The entire toxin is completely removed, destroyed and removed. Okay. So second way is through conjugation with the glucuronic acid or sulfates. By conjugating with these two substances, one or both of these substances, the toxic substance is converted into a non-toxic material. So by these two ways, liver detoxifies the toxic substances. So liver has a hematopoietic function. Hematopoietic means liver produces blood cells during the fetal life. When the child is inside the mother's womb, liver only produces the blood cells. So after birth, the blood cells are produced from your bone marrow. So hemolytic function, the senile red blood cells after their lifespan of 120 days are destroyed by reticular endothelial cells of the liver. The Kupffer cells are the reticular endothelial cells in the liver. We saw already, no? So the Kupffer cells are the macrophages, which are the reticuloendothelial cells, and they play a vital role in phagocytosis, that is the swallowing of the foreign material. Apart from that, it also helps in the degradation or the destruction of the senile red blood cells. Senile means old red blood cells. Only when the old red blood cells are removed, new red blood cells will be produced. No, so this is a very vital function in the happening in the liver. Okay. So due to the metabolic actions, heat is constantly produced in the liver. Liver is the organ where heat production is maximum. So heat production is happening in the liver. So secretion of bile. This is the very, very important and unique function of liver. So only from the liver, that is the hepatocytes, the structural and functional unit of the liver, this bile is secreted. So we need to see this secretion of bile in detail. So liver secretes bile, which contains bile salts, bile pigments, cholesterol, fatty acids, and lecithin. The functions of bile are mainly due to bile salts. The bile salts are required for digestion and absorption of fats in the intestine. So this is the biliary system. The biliary system or the extrahepatic biliary apparatus is formed by the gallbladder. This is your gallbladder and the ducts. Bile duct, common hepatic bile duct, and the common bile duct. So these all form the biliary system. So the extrahepatic biliary system is like a tree. The bile secreted in the hepatic cells, that is the hepatocytes, is poured into the thin canaliculi, that is the bile canaliculi. So these bile canaliculi unite together to form a small duct, which finally form the left and right hepatic duct. So we saw, no, the structural unit of the liver is the hepatocyte. So in the hepatocytes, the bile is secreted, and this bile is poured into the bile canaliculi, and this bile canaliculi collectively join and form the bile duct. Okay, so we have the right hepatic duct and the left hepatic duct. The hepatic ducts join to form the common hepatic duct. These two structures join to form the common hepatic duct. This common hepatic duct, you see here, this common hepatic duct join the gallbladder to form the common bile duct. Here you can see, no? So this common hepatic duct joined with the gallbladder to form the common bile duct. Right and left hepatic duct form the common hepatic duct. Okay. Cystic duct and common bile duct are structurally similar. The common bile duct unites with the pancreatic duct, forming the common hepatopancreatic duct. So this common bile duct, which is made with the gallbladder and the hepatic duct, no, this joins once again with the pancreatic duct. This is a very important thing you need to understand, because we will be seeing in the later parts of this presentation. So this common hepatic and pancreatic duct combination is there. No, this is called as the ampulla of Vater. So this is the ampulla of Vater, hepatopancreatic ampulla or ampulla of Vater. This ampulla of Vater opens into the duodenum. Duodenum is the first part of the small intestine. So there are some smooth muscle fibers at the lower part of the common bile duct. Lower part of the common bile duct has some smooth muscles. And this area is called as the sphincter of Oddi. You can see here, this sphincter of Oddi. So sphincter of Oddi takes important role in the storage of bile in the gallbladder. So this sphincter action only helps in the storage of bile in the gallbladder, as well as the from gallbladder the bile should reach the intestine for digestion of the fat, no? So that also happens only with the help of the sphincter. So this sphincter is called as sphincter of Oddi. Because of the closure of this sphincter, bile from liver is filled in the gallbladder. Okay. So this is the flow of bile through the bile canaliculi. The bile is secreted in the hepatocytes and it is poured into the bile canaliculi. Bile canaliculi, and this bile canaliculi join together to form the bile duct. Bile canaliculi are seen in between the hepatocytes. Filling and emptying of gallbladder. Bile is continuously secreted. The amount is less during fasting. The secretion is increased 3 hours after meals. Normally, during fasting, the sphincter of Oddi is closed. The pressure in the bile duct is about 7 centimeter of water. Because of this pressure, the bile from liver enters the gallbladder. So the bile is secreted in the liver cells, that is the hepatocytes. So from the hepatocytes, the bile is going into the bile canaliculi. So bile canaliculi form this hepatic duct we saw, no? So from that duct, it is going into the gallbladder automatically because of this pressure. While taking food or when the chyme means nothing but the, it looks like the vomiting, which we throw up, no? So this is the a partially digested form of the food present in the stomach or in the intestine. Okay. So while taking the food or when the chyme enters the intestine, the gallbladder is contracted along with the relaxation of the sphincter of Oddi. Sphincter of Oddi opens and the contraction of the gallbladder takes place. Now the pressure is about 20 centimeter of water. So the bile duct pressure increases from 7 to 20 centimeter now. Because of this increase in the pressure, the bile from the bladder enters the duodenum. So the contraction is happening once the chyme or the food touches the intestine. This contraction of the gallbladder takes place, and the the bile from the gallbladder is entering the intestine. So regulation of bile secretion. Regulation of bile secretion is by the contraction of the gallbladder. So contraction of the gallbladder happens through the vagal stimulation and through the hormone that is secreted in the intestine when the chyme touches the intestine. So this hormone is called the cholecystokinin pancreozymin. So CCK-PZ hormone. So the contraction of gallbladder takes place. And this in turn causes the release of the bile from the gallbladder. So regulation of bile is through two things. One is the secretion of the bile from the liver, and second one is the release of the bile from the gallbladder. So the things which increase the secretion of bile from the liver are called chloretics, and release of bile from the gallbladder is influenced by the contraction of the gallbladder. So the things which can increase the contraction of gallbladder are called as cholagogues agents. Let's see what are these chloritic agents and cholagogue agents. This knowledge helps us to understand which food will increase the bile secretion and which food causes the contraction of the gallbladder and why there is an increase in bile in some individuals. In homeopathy, we call them bilious constitutions or chloritic temperaments. So the cholagogue agents are calcium, fatty acids, amino acids, inorganic acids. All these substances stimulate the CCK-PZ secretion. So automatically it increases the secretion of the bile in the liver cells. Acetylcholine also causes contraction of gallbladder. So chloritic agents are secretin, acid chyme in the intestine, bile salts, acetylcholine secreted by vagal nerve endings, cholecystokinin. So when you see here, and one more agent which is responsible for the regulation of bile secretion is your hydrochloretics. So if you see in these two, whether it is a chloritic agent or it is a cholagogue agent, both are increased by the acetylcholine. So acetylcholine plays a very important role in the regulation of bile secretion. So when when the acetylcholine increases, when there is an increase in the acetylcholine, automatically there will be more production of bile and also extra contraction of your gallbladder. Okay. So what is this acetylcholine? Acetylcholine is an excretory neurotransmitter which can contribute to anxiety and depression. Acetylcholine increase maintains stressful memories by increasing attention to negative events. So we are constantly watching this negative things, no? So in the social media or in the news or in the serial or whatever it is. So these negative memories or negative things or increased attention for negative events are maintained by the increase in the acetylcholine. So increased acetylcholine causes anxiety and depression and also increases the bile secretion in liver and contraction of the gallbladder to release more bile into the intestine. Makes sense, right? So the digestive function of bile, as the lipids are insoluble in water. So this is a major function of the bile. So it is called as emulsification in medical terms. So emulsification, no, while making this soap agents and all, we read about emulsification. Same thing is happening in the same thing is happening with your fat, ingested fat. Whatever food you have contains lots of fat means that fat undergoes this emulsification process only with the help of your bile. So as the lipids are insoluble in water, various lipolytic enzymes cannot digest the lipids. Lipids are insoluble in water because of the surface tension. Due to the detergent action, the bile salts, we saw no, bile contains us bile salts, bile pigments, cholesterols and other things are present in the bile. Though the bile salts present in the bile reduces the surface tension of the lipid and makes the lipid water soluble. This action of bile salt on the lipid substance is called as emulsification of lipids. Due to emulsification, the fat globules are broken into minute particles. The emulsification of lipids is essential for their digestion by various enzymes of gastrointestinal tract. The emulsification of fats by bile salts occur in the presence of lecithin from the bile. So when you browse or read or try to know more about this lecithin, you will understand the role of this lecithin in weight reduction and fat loss and all. So now you may ask me, why should I know all these things? It's not my business. It's a duty of the doctor who treats me, right? So GHK means Germanic healing knowledge. So it gives you the knowledge about the healing happening inside your body. So your body is the only place where you will live for the rest of your life. So your body is your responsibility. You cannot completely, escape from your responsibility or give the responsibility in the hands of your doctor alone. It is your responsibility to make your own efforts to understand about your body. So this knowledge or the right knowledge comes from GHK or GNM. So GHK or GNM is a game changer. It releases you from the fear of diseases and empowers you to introspect the cause of your physical symptoms and handle them wisely. Now we will learn the liver from GHK perspective. So that is a topic of the day also. So the liver parenchyma is composed of intestinal cylinder epithelium, originates from the endoderm and is therefore controlled from the brainstem. So in GNM, we learn about the germinal layer from which that organ is derived and the control system of the organ, that is the brain relay center. After the birth of the fetus or the human being, from which area of the brain the organ is controlled also we will be learning. So liver parenchyma is a endoderm derivative and it is controlled by the brainstem. A person presenting with liver symptom or sign will have concentric ring called hammer focus in this area in his CT brain. This is the concrete evidence to prove the authenticity of this science. So in the brainstem, the control center of the liver parenchyma is orderly positioned within the ring form of the brain relays that control the organs of the alimentary canal, precisely on the right brainstem hemisphere between the stomach and the pancreas relay. Between the stomach and the pancreas relay, in the ring form of the alimentary canal organs, it is placed on the right hemisphere of the brainstem. This is very important for people who look for evidences to prove this science or to know from the CT brain itself what the person is going to have in the future on the physical plane as disease. So according to the first law of GHK, every organ has its DHS or conflict shock. So for liver SBS to be triggered, it is the starvation conflict. A person can suffer a starvation conflict in real terms due to a lack of food. In real term, it is a lack of food. Really not getting food. Okay, it is not something imaginary or figurative thing. Really not getting food can activate the liver parenchyma SBS. So when these lack of food scenario can happen, we will see the triggers to activate this conflict shock. So strict dieting where you do not get food. Though you may be a rich person or you will be having lots of money and lots of restaurants and hotels around you, you are on a strict diet and you are not your body is not getting food means it may that is your subconscious mind may think it as a starvation conflict and your liver SBS will be triggered. So not being allowed to eat one's favorite food. Same thing, no? So strict diet as well as not being allowed to eat one's favorite food. When a person is not allowed to eat his favorite food also, it is equated as a starvation conflict by your subconscious mind means you will be having problem on your liver. A colon cancer diagnosis associated with not getting food through the intestine, wearing a colostomy bag. So when the food is not reaching your intestine, this is also considered to be a starvation conflict by your subconscious mind and this may also trigger your liver parenchyma. So we will be seeing in the further slides that how this cancer diagnosis and not getting food are all contributing to the liver cancer as the metastasis, which is what to say, the conventional medicine calls it as a metastasis, but it has a concrete reason on the psyche level. Ongoing diarrhea, a loss of appetite and excessive vomiting during chemo treatments, unintentional weight loss can also contribute to a starvation conflict. So apart from this, apart from all these triggers and these scenarios, what can activate your starvation conflict on the figurative sense means a person can suffer a starvation conflict due to a threat of starvation. When one is unexpectedly in a situation of not being able to make the ends meet. So usually when a person is unable to meet his income and expenditure means there will be some insecurity, no? That threat of starvation will be there. This threat of starvation also can affect your liver parenchyma, and this can cause this liver diseases in that person. So where and all you can expect this threat of starvation situations? Loss of job, loss of job, pay cuts, loss of business, bankruptcy, loss of clients, layoff notice. So you're going to lose your job. That mail is reaching you, and this is happening very unexpectedly in a very untimely situation. It may trigger your starvation conflict instantly. So bankruptcy can also lead to starvation conflict. So financial debts, loss of savings, unexpected rent increase. So any unexpected expenses can also trigger this starvation conflict. So which will be taking off your resources, or which will be taking off your savings, which will be making you a bankrupt, will also have the potentiality to trigger this starvation conflict and produce symptoms on your liver parenchyma. A person can suffer a starvation conflict when when she or he has a economically devastating divorce. Okay, so if the um, if the breadwinner is making a decision to break up that relationship, and the lady is left without any source for money means, this may also trigger your starvation conflict and may cause liver parenchyma manifestations on your body. So confiscation of property. So what is confiscation means? Legal process by which a government or public authority takes property without compensation from the owner if it was acquired or used illegally. In India, we commonly see this situation. So people build houses in a place where it is not legally authorized, or where they do not have proper permission from the government. So after building the houses and all, the government will give a notice, and they will take off that property without giving any compensation to that person. The person will come to the street unexpectedly in a fraction of a second. So if this is happening also, this may also trigger your starvation conflict. So loss of a family member who provided financial support. So if a breadwinner is died means, this may also activate a starvation conflict in the other partner or the spouse, and may cause liver parenchyma conflict. In short, the conflict translates into the distress of running out of resources to feed oneself and those one feels responsible for. Can you relate it to the function of the liver? We saw no. So liver is a storage house of your body. So first law of GHK says that the function of the organ determines the conflict theme. So if you know the function in detail, you do not need to remember the conflict scenarios. So once you know the function of the organ, you can automatically remember the conflict theme by heart in your mind. So let's see the so-called diseases of liver, names at least, so that we will see them in detail in further slides. So hepatocellular carcinoma or liver cancer, benign focal nodular hyperplasia, single or multiple liver nodules, liver abscess, fatty liver, liver tuberculosis, renamed now as liver cancer, polycystic liver disease, hepatomegaly, jaundice, portal vein compression. So according to the second biological law, the conflict shock takes your body to a conflict active state. Only after the conflict resolution happens, your body automatically progresses to the healing phase. So if we see in the framework of second biological law, so the DHS is the starvation conflict, the conflict active phase. During the conflict active phase, the liver cells undergo a cell proliferation, and during the healing phase, that is after the conflict is lysed, the body automatically goes for cell loss assisted by TB bacteria. So you need to keep this in mind, then only you will understand the clinical manifestations of liver. So what is the necessity for the liver to increase the cells during the conflict active phase? This is called as the biological purpose in GHK. The biological purpose of the cell increase is to improve the function of the liver so that the smallest food particle can be used to its optimum. So we should not miss that smallest food particle also. Like that conservative mode, your body will be in a conservative mode. This your mobile will be going for this power saver mode, no? In like that, your body also will go for that power saver mode. So statistics says liver is the 7th most common cancer in the world and the second leading cause of cancer deaths. Now you will understand. So I told no, the real term lack of food will cause this liver parenchyma SBS or the starvation conflict. So the second leading cause of death in cancer patients is because of the liver cancer. So this is not happening haphazardly or the metastasis is happening like that. This conventional medicine people will be saying, but the real cause is the lack of food. And this is the 7th most common cancer in the world, they say. We will see the reason for this also. The highest incidence rate are in Asia and Africa. So, as projected by the conventional medicine, if this liver problem is caused by the alcohol consumption, means this should happen in the affluent community or in the developed countries only. This is happening in the developing countries or countries which are suffering from starvation, countries like Africa. So where food shortage is very much prevalent. So if alcohol consumption is a cause for the liver complaint means the incidence should be highest in the affluent community or in the US countries like US, where there is alcohol intake is high. But if you see, the incidence is high in the Asia and Africa only. Further, it is given that HCC cases globally are in the sub-Saharan Africa. You know the Sahara Desert, no? Where no resources are available, people are dying of starvation. In those areas only, this 80% of this liver cancer cases are seen, which means alcohol consumption is not the cause for the liver cancer, and it is because of the starvation that is taking place in the area collectively. So people who are living in the desert are struggling to procure food. They have a food shortage there. So if they are struggling to get the food only, where will they be going and getting alcohol for drinking? So you need to think about this. So such minute details and misconceptions given through conventional medicine can be dismantled through the right knowledge of GHK. So hanging conflict. So hanging conflict is when the conflict is not allowed to resolve and healing never happens. The conflict remains always in a CA phase, that is a conflict active phase. So the clinical manifestation will be the liver cancer or the hepatocellular cancer. So cell proliferation is happening in the conflict active phase and the body is never allowed to go for conflictolysis, or when the healing is not happening, constantly that proliferation will be happening, and this is called as liver cancer by the conventional medicine. If the proliferation is in a certain limit, they call it as a benign. benign liver nodule or focal nodular hyperplasia. If that limitation is crossed, means they call it as a liver cancer or hepatocellular carcinoma. So this is totally invalid in GNM because we know that conflict activity intensity is directly proportional to the proliferation of cell that is happening during the conflict active phase. Okay. Makes sense, right? So a single solitary liver nodule forms if one suffered the threat of starvation with or for another person, a family member, a beloved friend, a pet. If one person is involved in the starvation thing, only one nodule will be produced. If two persons are involved, two nodules will be produced. Three persons are involved means three nodules will be produced. So multiple liver nodules means not multiple persons are involved in that. Multiple liver nodules covering the entire liver indicates that the starvation conflict relates to oneself. So we know once the conflict is realized, the body automatically goes in for a healing phase. So healing automatically follows. So healing symptoms are pain due to the swelling of the liver and night sweats. The liver blood parameters are normal or within the normal range because now healing is happening. No, so liver abscess is a liver nodule filled with pus. We saw no, so liver nodules will be produced. So one nodule, multiple nodules. If that nodule is filled with pus, it is called as liver abscess. So if that nodule is filled with or the liver cell is filled with the fat means it is called as fatty liver. Okay. So why one person is having a pus in the nodule? Why one person is having fat deposit in the healing liver? Everything determines the individualistic nature of the person. So this is a main prescribing point for a homeopathy doctors to prescribe upon. So fatty liver refers to the fat deposits in the healing liver. Okay, now I will tell you two cases from my clinic. So where fatty liver was a presenting complaint. So Mrs. X, 41 years, right-handed female with normal hormone status. Her husband was running a business and earning handsome money. But after marriage, after a few months of marriage, her husband closed the business and there was no resources to run the family. So she has to work to meet the ends. She is always in a financial stress while her husband was frittering the time and spending his time happily on social media. Loss of husband's business and stoppage of financial resources was the conflict shock in this lady, and adding to it her insufficient income and constant night shifts with increased her starvation conflict intensity and made it a hanging healing, and this caused fatty liver in her. So I'll explain only the conflict scenario and the conflict and the presentation so that you can relate what I was talking till now. So next is the case of Mr. Y, 45 years, right-handed male with normal hormonal status. This man lost his dad in a sudden road traffic accident. His father's sudden demise itself was a conflict shock for him and his family members and triggered many SBS in them. The whole family comes to me for treatment, so I know the entire history of the family. But after his father's demise, he came to know that his father had a debt of 5 to 7 lakhs Indian currency money. Okay. This was a conflict shock. He slowly repaid them and the conflict was resolved. By God's grace, his salary also increased and he became wealthy enough to build his own house. But the burden of housing loan once again activated his starvation conflict. We saw, no? So the struggle to meet the ends can activate the starvation conflict. And adding to this problem, because of this lockdown, his construction work got stopped. And he was forced to pay EMIs without any progress in the construction of his house. This kept the person conflict active again. Okay. After the lockdown, he completed his house and came to the resolution once again, and he rented out the house and he got money and he resolved the conflict. But the thought of his father's death and the carry forward of his debt on him created tremendous insecurity in him, and he put himself again in a hanging conflict. He started thinking that what will happen to my family members, my wife and the two children, and my mother-in-law, my father-in-law, my mother, who are all dependent on me. What will happen to them if something unexpected happens to me in these 20 years tenure of housing loan repayment? He took a life insurance to secure his family and came to a healing again. But this repeated conflict relapses gave him the fatty liver in return. So I hope you can understand the concept of starvation conflict and the conflict activity which is producing the fatty liver in the individuals. So we saw that healing is assisted by the TB bacteria. So TB bacteria clearing of the cells produced during the conflict activity is considered by conventional medicine as liver tuberculosis. So liver tuberculosis is yet another condition happening during the healing phase of the liver parenchyma SBS. So more frequent in regions where there is famine, such as in Africa. So this is the thing given by the statistics given by the conventional medicine regarding this liver tuberculosis. They attribute the femininity or the poverty as a reason for the liver tuberculosis. But we know from GNM perspective that it is because of the starvation conflict activated by the famine, which is going in for healing, and that is why there is tuberculous bacteria which is coming to heal the organ. The correlation between tuberculosis and poverty has long been noticed by medical historians. So tuberculosis and poverty is related by medical historians, but the real understanding behind this is given only through the GHK knowledge. In the Western world, where tuberculosis is supposed to be eradicated, liver tuberculosis is now called liver cancer. The disease names have changed, the symptoms did not change. One more interesting thing I wanted to say about liver. So did you know that liver is the only organ that is capable of regenerating itself by making new liver tissues? This is called as the Prometheus phenomena. So bile secretion aids the absorption of fats. In addition to secreting bile, liver also produces cholesterol. So these are all the two things we usually miss out while we are learning about liver. So these two have a very good thing to know about the liver, so that how this replenishing or the cell multiplication is happening, how the removal of one lobe of liver will be compensated by the body, everything will be understood from this small piece of information regarding liver. So hanging healing is where the conflict is laced and the healing has also taken place, but the healing is never allowed to get completed. Healing is interrupted and the program is never completed. Healing is prolonged and continually interrupted by conflict relapses. The ongoing decomposing process leaves caverns in the liver. So repeatedly proliferation is taking place and the cell loss is happening. But again, the person is undergoing conflict activity, and repeatedly this cell loss is happening, means this leaves cavities, that is caverns in the livers. So liver cyst, also called as polycystic liver disease, develop when the caverns are filled with water. When the cavity is filled with water, it is called as polycystic liver disease. This is also a healing phase, but the healing is in hanging healing. So why water is getting filled up means you need to learn the syndrome part in the GNM, second biological law. I have given detail in a video in our YouTube channel about the second biological law of German New Medicine. You may go and watch it. So when the person is having an active abandonment or existent conflict, instantly his kidney tubule kidney collecting tubules program is activated, and there is a water retention, and this water retention, if it is happening in the caverns of the liver, means the person will be showing the clinical manifestation of polycystic liver disease. So water retained in the healing liver leads to an enlarged liver. So water is getting retained in the liver means healing liver means the liver will enlarge. And this is called as hepatomegaly. Hepatomegaly is the name given by the conventional system of medicine for the enlargement of the liver. Liver enlargement means what is enlarging there is the liver cells. Water retention is happening and the liver is getting enlarged. Most of the time, this is associated with the ascites. Ascites means water collection in your peritoneum. Peritoneum is the covering inside your abdominal cavity. So this hepatomegaly is associated with the water retention happening in your peritoneum, which is called as ascites. So when there is a large swelling close to the common bile duct, so we saw this image already, no? So if when the large swelling close to the common bile duct bears the risk of mechanical obstruction of the bile duct. So when the enlargement is happening around this area, means it has the risk of compressing the bile duct, and this may cause jaundice. Jaundice is a very common condition, yellow discoloration of your sclera and the skin, no? So it is very much known to everybody. So this may also happen when there is a enlargement of the liver with the compression of your bile duct. So acute complication arises when the swelling compresses the portal vein. When the portal vein is compressed, it has a very acute emergency condition, and this must need a surgery, says Dr. Hammond. So I told no. So why this liver cancer is the 7th commonest cancer in the world? We will see the reason behind it. Hazards of overuse of antibiotics and random cancer findings during master health checkups. I keep saying about this hazards during the findings happening during the master health checkups. So let me explain that once again. If the required microbes are not available upon the resolution of the conflict because they were destroyed through an overuse of antibiotics, the liver nodule cannot be broken down and therefore remains there itself. So we saw, no? So bacteria, TB bacteria is important for the removal of the extra cells produced during conflict active phase. With the usage of repeated usage of antibiotics, these bacteria are removed and the liver nodule remains there itself. Eventually, they become encapsulated with connective tissue. Such tumors are often accidentally discovered during a routine checkup or follow-up examination. So this is the hazard of master health checkup. During master health checkups, the organs which are undergoing cell proliferation during conflict active phase will be seen or found out or caught during the master health checkups. So before the psyche goes into a conflictolysis or conflict resolution and throw the symptom on the physical plane itself, they find that mass or the cell mass or the tumor or whatever you call, and they cut off the tumor or they remove that organ or do some surgical correction for that. Means the person will be in the hanging conflict for throughout his life. He cannot go for a healing because the conflict act removal of organ has already taken place means. So hence today's excessive use of antibiotic contributes significantly to the increasing number of cancers that are detected during medical examination. So it is the 7th commonest cancer in the world, means it is because of the excessive usage of antibiotics. I can tell you the example of my uncle, my maternal uncle, who's a teetotaler. He never even takes even that betel nuts or betel leaves, but he died of a liver cancer only. So when they were examining his liver, they were repeatedly asking him whether you drink, whether you have the habit of alcohol, intake, like that they were asking repeatedly, but he was not having any habit, any bad habit or any negative habit at all. But he used to pop antibiotics and he used to take this paracetamol tablets even without any prescription. He was working in a pharmacy, so he knows the remedy names and remedy, what to say, the allopathic medicines, no. So he buys them or he takes from his workplace and he takes by himself. So repeated usage of paracetamol and antibiotics can cause liver damage and liver cancer. So this is what I wanted to say through my uncle's example. So bile duct and gallbladder share the same relay center, but these two are entirely different. So I'm not going to cover this in this presentation. So in some other occasion, I will speak on these two organs. Let me brief only few things about them now. So bile duct and gallbladder share the same brain relay center. So both are affected by the same conflict. In male, it is the territorial conflict. In female, it is the identity conflict. In females with the low estrogen status, that is during pregnancy, when the estrogen level is low, females are also affected by the territorial conflict. And this territorial conflict causes the lady to have a child with the neonatal jaundice. Nowadays, we see lots and lots of neonatal jaundice, no? So they keep the child in the phototherapy, for phototherapy. Nowadays, after every cesarean section, the baby is kept as a routine. Routinely, they are keeping the child, even if there is a slight increase in the liver profile test and all. So this is because the lady who is in the pregnancy, who is in the low estrogen status, undergoes a territorial conflict, and that conflict is reflected in the child as a neonatal jaundice. So I will speak about these things in some other occasion. So conflict active phase, during conflict active phase, the ulceration of the lining takes place, inner lining takes place. During healing, cell proliferation takes place because these two organs are developed from the ectoderm and they are controlled from the cerebral cortex, that to the temporal lobe of the post-sensory cortex. So this is exactly opposite of the liver parenchyma. Liver parenchyma SBS, the cell proliferation takes place during the conflict active phase, and here during healing only the cell proliferation is taking place. So you need to know these minor differences, then only you will know whether the person is in the healing phase or he is in the conflict active phase. This will help you to guide him in a proper way. So before I end up my session, so these are all the resources to learn GNM. www.learninggnm.com is an authentic website by Caroline Madam. You all can go and browse the website. You will get lots and lots of surprising facts about our diseases and other things. So it's a very interesting and useful website and authentic website also. All the participants are requested to visit our website www.globalgnm.com for more free basic videos. Free basic videos, testimonials are also available in our Global GNM YouTube channel as well. www.dannycarroll.com is the website of Mr. Danny sir. So this website gives you complete details about the resources available on GHK and GNM. So with this, I finish my liver and GHK perspective presentation. Thank you all for patient listening. Thank you.